Alright, so now we're going to be moving on to the next part, which is the form. So I already covered this. I showed you how to select which one you're actually going to be inputting for. In this tutorial, we're going to be trying to put in a chest routine competency, because this is going to be the very first comp that you're going to be getting. So let's hit next. Alright, so it's going to bring you to this page. This is the form where you're going to be putting in all your information that you got from the exam that you just comped on. So let's get to it. So up here it's going to have your name and the type of competency that you're inputting, and then the date. Just doubly make sure that this is correct, because you don't want to be putting in a risk competency under a chest routine. That's just going to create a whole bunch of mess. Anyways, so we are inputting our own competencies. The tech doesn't do it, the CI doesn't do it, and your clinical coordinator doesn't do it. It's going to be you. So some people might feel like, oh, I'm like inputting my own stuff, you know, how do I know that I deserve this competency or whatever? If you want, there is a printout of this form that you can find in your Yuba College binder. I'm 100%, well, that's kind of too sure. I'm like 95% sure it should be in there. Anyways, you can give it to the tech that you're comping with, and they can kind of just check off each of these categories, and it kind of gives you peace of mind that you earned this competency. At least that's how I was for some of mine. Anyways, so you can give that to them and they can check these off, but most likely you're just going to be inputting this, and you should know whether you're getting the competency or not, because this is all basic patient care. This is basic positioning. You know, this is basic image critique, like whether you think your image is good enough. And when starting out, you're not going to be 100% sure. That's probably when most likely I would use this form. But other than that, when you start getting later in the program, you know, you're going to start knowing, like, yeah, this is a good image. And if the tech, you know, approves you on it, then you know that you got the competency, and they're giving it to you because you covered all of these areas. Most of the techs out there are seasoned anyways, and they know what to do for competencies, and they know what they're supposed to be looking for, and each hospital is even different too. So one competency in one hospital might be a lot easier than in a different hospital, a lot harder in a different hospital. So, you know, essentially this form, you know, you're just going to be filling out yes, yes, yes until we get to this part, these two last parts, which I'll explain in a little bit. You know, but this is, like I said, stuff that you should already be doing for every exam. This right here, just to kind of really talk about it, it's the last 5 digits of the accession number. Each requisition is going to have an accession number that's going to pertain to that exact exam that you're comping on. And so you just want to put in the last you know, 5 digits. It helps your CI to access the images instead of having to find and search through packs. And I also like to make note that you should write down the full accession. It is a HIPAA, but it'll help in the long run for you to like bring up your past images, you know, so that you can critique them and everything. But like I said, it is HIPAA, and you know, you need to make sure that you keep it like secret and stuff and keep it hidden. But it helps, you know, education wise. Just make sure that you're not showing off that book to anyone. You know, you kind of keep it at your locker for work or at work or whatever, you know. Just something that you can have on hand, like when your clinical coordinator comes and looks at your images as well, so you're not spending hours upon hours trying to find the images that you comped on. So anyways, moving on to the actual form here. So like I said, every single one of these categories is something that you should already be doing for every exam, despite it being a competency or not. This is just basic patient care that I'm sure that you have already gone over by now, or will be going over. But you want to make sure that, you know, you that you, you know, that you do every single one of these. You know, make sure that the requisition is identified with the patient, you know, that they correlate, and things like this when it says when appropriate. So obviously you're not going to ask a man if they're pregnant, right? So just in this case, like let's say that our patient is a male, you will just say no. I mean, I know it says when appropriate, but it just lets the person who's looking at this form, whoever it may be, you know, one of the three, that you look through it. So you know, you just say NA, and then you can say male if you like. It just kind of shows like, hey, I read through this form, instead of saying yes, 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 yes. Provide instructions for changing to a gown. Chest, more often than not, they'll have the patient change, especially if it's a female, but like I said, it's different per hospital. So, you know, for a man, if they don't have anything wrong, you know, with their shirt that they're wearing, you don't have to have them change it to a gown. You know, so you just say no, and then, you know, you could just say NA because it wasn't applicable to the clothing they had or something. You know, let's just say that. And then explain the procedure, you know, provide explanations. Always, you know, talk to your patient in plain language and talk to them throughout the exam so they know what's going on, you know, because you know what you're doing, especially if you're doing competency, but the patient doesn't know. You know, so make sure that you do all that. Provide appropriate instructions upon completion. You know, you don't want to just be like, all right, bye, you know, get out of here. You want to be like, all right, it'll be like 2 to 3 hours or 1 to 3 days for, you know, results, etc. Technical procedure and positioning. You know, make sure you use your correct left and right marker if it's a right wrist, right marker, etc. You know, that you did all this, position the patient correctly, you know, use of mobilization devices. You know, you can just say no again and NA just because it shows that you read the form, but when appropriate, you know. And then provide a proper collimation, definitely, you know, so this is all stuff that you should be going and aiming for when you do a competency. So yes, yes, yes. Proper shielding, you know, sometimes you can't, like for a pelvis or an abdomen, so you could just say no, and then NA, and then you just be like essential anatomy in view or something like, you know, something like that if you wanted to, but really you could just say yes. For chest, you do have to provide shielding despite age, you know, like 0 to 105. Just do shielding. The techs are going to look at you crazy, but, you know, especially when they're older, but just do it because it's good practice. So yes. And then appropriate selection of factors. You know your KVP, know your mass before attempting the competency. It's going to be something that you're not going to really think about because the computers do it for us nowadays. But you still want to know why you're doing that selection and you know, when. So, provide a proper breathing instructions, a chest, you know, there is breathing instructions. So yes, you know, and you can say, well, no, never mind. Anyways, so equipment management, that you know how to use the machinery that you're, you know, using. Yeah, that's basically all that's there, you know. And then you clean the room prior, you know, you set it up before getting your patient, so you're not spending that time, you know, getting, while you're supposed to be talking to your patient about history, you're not spending that time setting up your room, etc. So yes, yes, yes. Image critique and post-processing. So these last two sections are actually pretty elaborate. So this is where you want to be mainly putting in a lot of your information. So this is mainly for you, and this is for you to know that, you know, you did this correctly. So beam restricted essential anatomy, you know, yes, you didn't get a C-spine along with your chest. Essential anatomy is demonstrated. You know, yes, you included, you know, costos and apices. You can, you know, basically everything I'm saying you can put here to show them that you know what you're doing. Essential anatomy is in the center. Yeah, you know, images free and appropriate motion. You know, they're not swaying back and forth. Evidence appropriate breathing technique. Yes, you can say air-filled trachea. You know, you can say 10 plus ribs. So they know that you know what you're doing. No anatomy is removed, like let's say you did get that C-spine accidentally and then you clipped it to make it look like you didn't. You say yes, because we didn't do that. And then no presence of artifacts like, oops, the female had a bra on, you know, like you forgot to take that off. So yes, we, you know, didn't have any artifacts. For this, sometimes it's different, but you might have to say no when, like, let's say you're doing an inpatient and, you know, there's all these wires and everything. So you can say no. It won't count against you. You can say no, and you can say, like, other medical devices and image or something, you know. So just kind of shows them, like, hey, I do recognize that there are artifacts in the image, but it's not to my own accord. I tried to remove them, you know, etc., etc., and that just lets them know. Markers are present, so of course always have your marker on there, digital markers for the tech you're doing it with, and things like, well, that's actually in this section. So yeah, digital markers of your tech that you did it with is okay, but just make sure that you have your actual marker on the image. Appropriate density, make sure that your EI number is good. We'll cover that later. Perform any post-processing and documentation. So this would include like, so you could say yes, and this is actually a category where it's going to make you explain why, I believe. But you'll say yes, and then you can be like, added upright, marker and that kind of thing, and it just kind of lets them know that you did add stuff to the image, but it wasn't taking away from the actual diagnostic thing from the image. And then was a repeat required? This automatically says no. We're not allowed repeats, so you just say no. But for some reason, this form will be like, "What do you mean no?" And then it'll want an explanation. So just always put NA there because or none required, because it'll give peace to Trajecsys and it won't flip out, and then it'll none was required, right? So because we're not allowed one. So yeah, that's what you put there. And then, so now technical factors. So this is all the little bitty numbers that you're going to need from your exam. You're going to get it off of your image. So you're going to just put like projections and positions for all images. So you're going to put PA and lateral, because those are the two protocols. And then you're going to put, the KVPs for every machine. Every machine is different, so you could put like 110, or something like that. But you would put it for like every position, and then you just separate it by the comma like that, and then you could just do, like that, and then like that, et cetera, et cetera. So you just, follow this kind of process. You do this method, then just, make sure that you, do this method, et cetera, et cetera. Yeah, so you just, keep doing that. Photo cells. You could say all three, or you could say top, left, and right. That's what you would be using for a chest. So chest would be top, left, and right, and you'll get to learn all this later. And then lateral would just be center. So, that's what you do that. And this, you're establishing the differences with the comma, so it lets them know that you're talking about the different ones. Grid ratio, this is different per hospital. So you would just put 10 to 1, because that's what the ratio of that grid is for that wall bucky for whichever hospital. 72 inches is the SID for a chest. ER range is different per hospital, so this is something that you're just going to have to be looking out for. I'm just putting, for an example, let's see, 1100 to, 2300 or something like that. Then you would put for each image, so you would put like, 1434 for the PA, and then you would put, 1299 for the lateral. And then name of tech, so you'd put, comp, their last name, and then, or tech comp, so their last name, then their first name, and then their, their license number, I believe you have to put there as well. So just make sure that you have that information as well. And then the date that you did it on, it will have it on the form, but you might as well just put it here. You do have 24 hours to put in a comp, so you might have done it yesterday, so just, put what day you actually did it on. So the form is going to have its own date, but this is going to have, the actual date that you did the comp. So let's just say that we did it yesterday, and then time of exam, we'll say we did it at 3:30. So, put it in military time. And yeah, that's how you input that information. You're going to say not approved. It's always going to be on approved. Doubly make sure you're saying not approved, because you're not approving your own exam, because we can't do that. So just say not approved. And, just doubly make sure that you have everything that you need in there. And you are. So now we're going to just say submit. And it's going to bring in this, and it'll be competency was successfully saved. And that is how you input a competency.